Good evening. We're very happy here today and honored to have Dr. Suresh, who's the Vice Chair of the International Committee at the American Heart Association and the Executive Medical Director of St. Elizabeth Medical Center. And we're here chatting at the side of the 15th International Conference for the Jordan Cardiac Society. And we were discussing a lot of things which are very interesting and really important for our society and for the global health. So one of the things, Dr. Suresh, you're talking about was about the systems of care and the importance of the systems of care in taking care of our patients. Can you please tell us a little bit more about it?
So unfortunately, patients in Jordan are having heart attacks at the age of 40, 45, related to various reasons. If we develop a system of care by which all patients coming to the hospital have a method by which they are managed before they go to the cath lab or before they go getting a procedure, and then after they have the procedure, how they are managed. The idea is to develop a system of care from the time the patient comes to the hospital till the time the patient leaves. And if we can develop a Jordanian system of care over a period of time, including multiple hospitals, not only in Amman, but also in the smaller towns surrounding Amman, that will help a lot of people in the Kingdom of Jordan. So
that's exactly right. So the idea is we're not talking about transplanting another system. We're talking creating a system that best suits us, suits our patients.
Exactly.
And the more involved in it, the more effective that system and more care we deliver to our patients.
Exactly. The idea is this is not the American system of care that we are trying to bring. It's the AHA is helping the Jordanians and the physicians here and the systems here to come up with their system of care so their patients can benefit from it.
Amazing, thank you so much. And also, we were talking about the effect of campaigns and, reaching the public. And one of the problems in Jordan is actually we have a very high tobacco abuse problem, different types, whether smoking, the shisha, vaping, and so forth. And of course, we all know how much effect it has on the heart. So any ideas, how can we tackle this? It's an important thing, and it's reaching even the young adolescent population. So how can we help?
I would say that smoking is this number one, number two, number three reasons young patients get heart attacks, whether it's 35-year-old or a 40-year-old. If they are having a heart attack, they're probably a smoker. So the way we should do is we should develop a campaign starting in schools, in middle school and high school, teaching the kids about smoking and the effects of smoking, so they can go and tell their parents and their grandparents rather than us telling them that they cannot smoke. So starting at the age of 7 to 10 to 15, if you can develop a Jordanian mechanism by which schools are teaching these young kids about the problems of nicotine addiction, the problems of smoking, the problems of vaping, all of this is a huge, some of it you can try, but some of it, this has to be a multi-year effect to change cultures in some way or form. So
yes, thank you. And also on the subjects of campaigns, another area that we'd love to have more awareness of is CPR awareness.
Yes.
We all know that if you initiate the CPR, the earlier, the better survival. And even if it's a simple CPR, so if we could spread that to the community and more awareness of AED, that would be great. How can the AHA help us with this?
I would say we should have CPR, an introduction to CPR in high school. So every student that is in high school learns about the basis of CPR in 9th grade, 10th grade, 11th grade, and 12th grade. So for 4 years, they hear about an hour. That's all they need, an hour of CPR education. We have done it in some of our schools in America. The idea would be if we can develop a Jordanian version of it and teach the kids in high school, that will go a long way, and whichever profession they go into subsequently, they would know at least the basis of CPR. And in the community, it spreads. So if somebody goes down, then you can help them. So.
Great. Thank you so much. Welcome to Jordan. It's really a pleasure having you here. We're very happy to have you, and hopefully this will be one of so many visits together. And welcome to Jordan.
Great.
Thank you so much.
Thank you so much.
Appreciate it.
Thank you.
Thanks.